Parental neglect and the life course theory. Life course theory, developed in the 1960s, explores how psychological, sociocultural, and life cycle forces contribute to human development. In this presentation, we examine how parental neglect affects people throughout their life course and explore the role of human services professionals in addressing the issue. Life course theory emphasizes the impact of early childhood experiences, transitions, and cumulative advantages or disadvantages on individual development. When applied to parental neglect, this theory helps us understand how factors such as parental behavior, family dynamics, and socioeconomic status influence the risk of neglect across different life stages. By recognizing the interplay between individual agency and structural constraints, we can develop targeted interventions to prevent and mitigate the effects of parental neglect on children and adolescents. Doyle and Cicchetti report that attachments formed in infancy later influence later developmental stages. Adverse early childhood experiences can lead to abnormal attachment behaviors, deficits in social emotional competencies, and enduring challenges in social functioning and relationship outcomes, particularly disorganized attachment behavior. In comparison to their peers, children who have experienced maltreatment are more likely to actively withdraw from social interactions and display more aggressive behavior when they do interact. The past has the potential to shape the present and the future, which can be envisioned as a ripple effect or a domino effect. The focus of this presentation will be on infancy and early years from age 0 to 5. Public Health England 2019 reports that investing in preconception, pregnancy, childbirth, early childhood, adolescent health, and development can generate a significant benefit to cost ratio of 10 to 1, encompassing health, social, and economic advantages with the potential to lower the incidence of mental health disorders and non-communicable diseases later in life. The authors emphasize that particularly within the first 1,000 days of a child's life, interventions can shape their entire lifetime trajectory. Exposure to toxic stress, such as abuse or neglect during early childhood, can detrimentally affect brain development, cognitive functioning, attachment, and academic performance. While young children are more susceptible to the adverse effects of toxic stress, early interventions during this pivotal period proves most effective in mitigating its impact. Providing early services and interventions to support healthy development in young children yields positive outcomes that extend from childhood into adulthood. Interventions. Factors such as parental substance abuse, mental illness, and domestic violence further exacerbate the risk of neglect, highlighting the need for comprehensive support and intervention for affected individuals and families. I chose the role of child welfare social worker in order to support children and those raising them, both of whom need help during this stage of development. Public Health England suggests that to give children a good start in life, it is important to support reliable and secure relationships with caregivers, emotional well-being, brain development, educational development, and the ability to form and maintain relationships with others. A child welfare social worker can facilitate training, classes, and resources for caregivers, respond to cases of abuse and neglect, remove children from unsafe environments, develop reunification plans, and provide counseling to those affected. This human resource role is a prominent piece in a larger care team system. In addition to child welfare social workers, collaborative care teams for children and adolescents affected by parental neglect may include professionals such as pediatricians, teachers, therapists, and the State Governmental Department of Human Services, or DHS. Each member brings unique expertise to address the multifaceted needs of the population. Pediatricians and teachers can spot the signs of parental neglect. Therapists aid in psychological exploration and treatment, and the DHS makes legal decisions around child custody while providing resources to parents. Collaboration and communication among team members are essential for delivering integrated, holistic care that promotes the well-being of children and adolescents affected by parental neglect. In conclusion, life course theory provides a valuable framework for understanding the complexities of parental neglect and guiding interventions to support affected children and adolescents. Human services professionals, particularly social workers, play a pivotal role in addressing parental neglect by providing counseling, advocacy, and support services to affected individuals and families. By working collaboratively within care team systems, we can create comprehensive, responsive